Hello friends, good evening to all. Most welcome to our YouTube channel Vet Bhai GYAN. So today we will solve one more paper, that is Surgery and Radiology paper second, which comes in 2021, and the syllabus was Unit 5 and Unit 6, and Unit 5 was Regional Surgery second, and Unit 6 Orthopedics and Lameness. So let's start the paper. So we start with fill in the blanks. The first fill in the blanks was jugular pulse is seen in. So it's commonly seen case in TRP. So you can understand jugular pulsation and engorgement of jugular vein. You can observe. Then second Phillips Days is communication between artery and vein that bypass the capillaries. So it's a common question that anastomosis. You can see a natural or surgical joining of tubular structure together so that they become continuous. So days, third question is days is distance between the successive improvement of same foot. So answer is stride. Fourth Phillips in diaphragmatic hernia, days most commonly herniate into thoracic cavity. तो reticulum mostly herniate होता है. The treatment of acute severe grain infection is done by, ये severe grain infection को ही कहते हैं rumen acidosis. So it's rumen infection, so treated by rumenotomy. So sixth Philip perforating wound in teeth is known as, so it's teeth fistula. If the question is incomplete, so answer might be teeth fistula. Cystopexy is commonly advocated in. So what is cystopexy? It is a surgical attachment of gallbladder or urinary bladder to the abdominal wall or other supporting structure. तो किस लिए कब करते हैं? जब वेसिकोसिल कंडीशन में करते हैं. तो वेसिकोसिल क्या होती है? A type of pelvic organ prolapse where bladder herniate into other anterior wall of vagina. Next, Phillips 8 days of intestine is twisting of ball on its axis. So it's torsion. Bernal Mayer suture pattern used to repair an injury of tendon. Repair of ruptured urinary bladder is referred as cystorrhaphy. Rhaphy means कुछ जोड़ना. This is performed to treat upward fixation of patella, that is MPD, medial patella desmotomy. इसको सनक, टांस, सुन, सरण, चिटकी ये भी कहते हैं राजस्थान में. फिर है oozing of inflammatory exudate at coronary band in horse is referred as क्यूटोर. यहाँ पे आप देख सकते हो जो पिंकिश स्पॉट है वहां पे होता है कोरोनरी बैंड, यहाँ से होता है कंडीशन. फिर है इन्फ्लामेशन ऑफ स्टाइफल जॉइंट इज नोन एज गोनाइटिस. The habit of horse to taking the weight off during the rest from one normal hind limb to alternate is referred as, it might be camped behind condition. Next Phillips in retrograde pinning, days pinning, the pinning is inserted from within the fracture site. Fracture site से हम पिन कब डालते हैं? जब उसको कहते हैं retrograde pinning. 16th Philip days is removal of motion from joint by fusion of the opposing surface into solid bony unit. So it is arthrodesis, in which surgical fusion of two bone at their joint to reduce pain and increase stability of joint. You can see in picture also. 17th Phillips two or more pins together used in adult animal, especially in femur and humerus, is known as स्टेकिंग करना, ताकि जो डायमीटर है, क्योंकि फिक्स डायमीटर होता है, उसको कवर करने के लिए. तो 3-4 पिन डाल देते हैं मेडुलरी कैविटी में, जिससे स्पेस ऑक्यूपाई हो जाए. 18th is combination of intramedullary pin and bone plate interfixation technique. So it's duty for you, reply in comment box. 19th Phillips is referred as ossification of collateral cartilage of forelimb. इसको क्या कहते हैं? साइड बोन. इसमें क्या होता है, ossification of collateral cartilage of third phalanx. 20 Phillips days is caudal aspect of forelimb from the carpal joint distally. This condition is called calf knee, in also called palmar deviation of knee, in which carpus will be behind the line. You can observe in diagram also. Now let's discuss MCQs. First MCQ, urinary calculi form in which animals? So its answer is olive. ये है कि कास्ट्रेटेड एनिमल में ज्यादा होता है, उसमें भी कास्ट्रेटेड मेल में, लेकिन होता सभी में है. फॉलोइंग विच इज अब्सेंट इन इंटरनल हर्निया. तो एक्सटर्नल हर्निया में तो तीनों मिलेंगे, पर इंटरनल हर्निया में क्योंकि सेक जो होती है वो स्किन या मसल को ही हर्निएट करके बाहर निकलते, लेकिन जो इंटरनल में ऐसा कुछ नहीं, इंटरनल में स्किन होती नहीं है, इसलिए हर्नियल सेक अब्सेंट इन इंटरनल हर्निया. Bread and butter appearance of exudate inside pericardium of cow is seen in case of. So its answer is traumatic pericarditis. ऊपर नीचे फूड बढ़ जाता है. टेलीस्कोपिंग ऑफ इंटेस्टाइन, एक इंटेस्टाइन दूसरे इंटेस्टाइन में घुस जाती है, उसको कहते हैं इनटू ससेप्शन. सेकंड ऑप्शन. A fluid thrill on abdominal ballotment is often noticed in rupture of urinary bladder. उसके अंदर फ्लूइड थ्रिल देख फील होती है. फॉलोइंग विच इज नॉन ए यूट्रिचट मेथड. यूट्रिक मेथड किसमें, लेफ्ट फ्लैंक ओमेंटोपेक्सी को कहते हैं. प्रोट्रूजन ऑफ एब्डोमिनल ऑर्गन थ्रू इंगुइनल कैनाल इज कॉल्ड एज बुबोनोसिल. मेजॉरिटी ऑफ अबोमेजल इंफेक्टेड पेशेंट shows metabolic alkalosis is right answer. Most common complication seen in mid-ventral abdominal raplotomy in cat is incisional hernia. It's right answer. And perineal fistula commonly seen in German shepherds. How much time is taking to regrow out hoof fall in adult horses? 9 to 12 months. We will discuss this how it possible. The toe of the hind foot hits sole of the forefoot of same side. तो सेम साइड को कहते हैं फोर्जिंग, एंड डायगोनल में होता तो क्रॉस फायरिंग. तो हमने देखा था एक एमसीक्यू. तो एवरेज हुप ग्रो 1/4 to 3/8 inch per month. Since average hoop is 3 to 4 inch in length, so horse grow a new hoop every year. And second question was cross firing, striking of inside diagonal fore and hind foot, usually inside of the hind foot hitting the inside quarter of diagonal forefoot of passer. And foraging, toe of hind foot hits sole of forefoot on same side. 13 MCQ. Chronic hypertrophic most eczematous dermatitis of wound producing tissue of the foot is known as canker. Dropped elbow seen in radial nerve paralysis. Ossification of proximal sesamoid bone is referred as sesamoidosis. Main etiological factor responsible for articular ring bone is, इसमें ये डाउटफुल है, लेकिन ट्रॉमा में भी द आंसर. For internal fixation, fractured femur in dog can be approached by lateral approach. It's very simple question. Delayed union is partial cessation of osteogenic activity. The minimum amount of observable callus is encountered in this second and third option may be correct, either second or third, in which fracture two or more fracture lines interconnect each other at one point. It's a communicated fracture. Now let's discuss defines. The first define is Meckel's diverticulum. So what is Meckel's diverticulum? It is also known as vitelline diverticulum. Is congenital anomaly found in animals and birds. Is an appendage of small intestine with immunopathological significance. Meckel diverticulum is most commonly found in horses and swine and less common in ruminants and carnivores. So very simple definition. Second, cecal dilatation in cow. So cecum may undergo distension, displacement, torsion, and including spiral colon. Free end of cecum is cattle is devoid of mesentery and subjected to rotation. Dilatation may precede or follow the torsion, and condition is more common in dairy cow following parturition. You will find many videos of cecal dilatation in YouTube. You can search and see the whole procedure. It's better for you. Vasectomy. It refers to removal of segment of ductus deferens to render male animal infertile. It inhibits male fertility while maintaining male behavioral pattern. Androgen continue to be produced because Leydig cells are not significantly altered. Rarely recommended because roaming aggression urine marking persists, while reduction of hormonally associated disease doesn't occur. Fourth question, define Liptech test. So this test conducted by using 18 gauge needle is inserted aseptically just below the area of resonant ping in left or right LD or either RDA abdominal wall, and fluid is aspirated. If pH of fluid is between 1 to 4, abdominal source is expected. If pH is between 5 to 7, remnant fluid has been aspirated. Gut tie. So gut tie is pelvic hernia, intra-abdominal hernia, peritoneal hernia. All these are named. This condition has been associated with open castration of cattle by reaction of spermatocord, which may result in either retraction of spermatocord or into abdomen with adhesion formation or obstruction or incarceration of intestine. Generally, hernia occur on right side, and it's very rare in animal. Leprocentesis. It's also called peritinocentesis. Paracentesis is form of body fluid sampling procedure in which peritoneal cavity is punctured by needle. It's commonly performed in condition ascites, in which trocar and cannula is directly through the skin subcutaneous amniotic part of oblique abdominal muscle, rectus abdominis, D fascia and parietal part is to enter peritoneal cavity. फिर enterotomy is surgical incision into an intestine. It may be purposeful or complication of abdominal surgery such as exploratory laparotomies or hernia repair. An enterotomy can be done to remove obstruction or foreign body from intestine. Procallus. This is initial stage of healing where hematoma, a pool of blood and immune cells, form at the site of fracture. This hematoma, sometimes referred to as procallus, start to clean up debris from break and deal with any foreign organism that might have entered the area if skin was damaged. Then oncopectomy, it is popularly known as declawing, is a surgical operation to remove animal claw. This is done by means of amputation of all parts of the distal phalanges or end bone of the animal's toe. The claw develops from germinal tissue within the third phalanx, so amputation of bone is necessary to fully remove the claw. Spavin test is diagnostic method used to identify bone spavin, a condition that affects the lower hock joint of horses. The test involves holding the hock in forced flexion for a period of time before trotting the horse away immediately. A positive response to this test, often characterized by temporary worsening of the lameness, would support the diagnosis of bone spavin. Then arthritis, very simple definition. ये horse में common है. It is characterized by inflammation of joint or joints, leading to reduced performance, pain, and lameness. Kumri, this condition we also study in parasitology and medicine disease. It is also called cerebrospinal nematoidosis, in which it affects sheep, goat, horses. The parasite belong to genus Hetaria, Ceteria digitata, commonly found in peritoneal cavity of cattle. This parasite invades central nervous system, and it can cause symptoms like incoordination, weakness, paralysis. In horses, this condition is known as Kumri, is translated to weakness of the loin. So it induces lameness, That's why we also study in this. Now discuss short note. The first short note is classify various foreign bodies of found in rumen. So there are mainly two type of foreign bodies ingested by bovines: potential and non-potential. Potential foreign bodies like wire, nail, needle, and any other sharp, stiff, metallic, non-metallic object which is able to penetrate GIT cause TRP and it associated with complication. However, non-potential foreign body include polythene bag, rope pieces, cloth pieces, mainly cause either infection of rumen or obstruction of rumen reticular orifice, popularly called plastic menace in cattle. मतलब प्लास्टिक का एक कट्टा भर लो इतना उसके रुमेन से निकलेगा. Classify various cause of intestinal obstruction. काफी होते हैं functional obstruction. These associated with altered intestinal motility, often due to dietary or management factor, phytobazor, parasitic infection, enteritis. Second है mechanical obstruction. These occur because of abnormality in bowel lumen, bowel wall obstruction external to GI tract. Mechanical obstruction include congenital obstruction like atresia jejuni, coli, recti, and ani in cow, atresia ani in lamb and pig. In horse, transient functional obstruction are common. फिर है extraluminal obstruction, and then fourth intramural obstruction, and fifth intraluminal obstruction. Third question है classify hernia. So hernia classify on various types on the basis of location. It may be external or internal. External include ventral hernia, umbilical hernia, and internal में DH cut type, and functional alteration में reducible and irreducible hernia. Irreducible hernia again divided into three types: hernia with adhesion, incarcerated hernia, and strangulated hernia. Then on the basis of cause, it may be traumatic and infectious, and on the basis of content, it may be intestine, omentum, reticulum, uterus, and many more. Then draw well level diagram of all possible sites of obstructive urolithiasis in bovine. So this is a diagram, and you can see in ureter it may be there, urinary bladder is also there. You can see yellow highlight, these are possible sites. Pelvic urethra you can see in penis also. Sigmoid flexor, this is most common site in bovines. Then glass penis also. Then define lameness. Lameness is indication of structural or functional disorder in one or more limb which may be manifested in progression or standing position. It also known as claudication. इसके causes क्या है, इसको full form से याद कर सकते हैं डैम निट. डी का मतलब डिजेनरेटिव डेवलपमेंट, ये कारण हो सकते हैं डिजेनरेटिव कॉजेज, डेवलपमेंटल कॉजेज. ए का मतलब एलर्जिक कॉजेज, ऑटोइम्यून कॉजेज, ये ट्रिक बना रखी है डैम एनआईटी. एम का मतलब मेटाबॉलिक कॉजेज, मैकेनिकल कॉजेज, मैनेजमेंट हो सकता है. एन का मतलब न्यूप्लास्टिक, न्यूट्रिशनल. आई का मतलब इन्फेक्शियस कॉजेज, इन्फेक्टेड वुंड, inflammatory, immune mediated, ischemic, iatrogenic, idiopathic. And T मतलब traumatic and toxic. These are causes, most common causes of equine lameness. Then physiotherapy. It is defined as therapeutic use of physical agent or means such as massage or exercise to treat disease or injury. The aim is to restore mobility, function, or quality of life to patient. This is done by stimulating the healing process to restore injured tissue and improve the balance strength of injured tissue, and establishing the cardiorespiratory, neurological, and musculoskeletal system. Then fracture. So fracture we will discuss. It is a breach in continuity of bone or any hard structure with or without displacement of fragment. So its classification based on external communication with the environment, like simple fracture, closed, open fracture, compound. On the basis of anatomical location, diphysial, metaphysial, physial, epiphysial, condylar, articular, periarticular, bone involved, like axial skeleton से भी हो सकता है, appendicular skeleton से भी हो सकता है. Complete incomplete fracture. Incomplete fracture include green stick, fissure, depression. Complete fracture include transverse, oblique, spiral, comminuted, segmental, multiple, impacted, compression, avulsion. Then luxation. Luxation is also called dislocation. So it is a separation of articular surface of bone. When there is only slight change in relationship of articular surface of bone, it is called partial dislocation or subluxation. Its classification include complete dislocation, partial dislocation, acute luxation, chronic luxation, recurrent luxation, simple luxation, compound luxation, complicated luxation, fractured luxation. Now let's discuss major question. The first major question is about described in detail about etiology, clinical sign, diagnosis, treatment of traumatic reticulo-peritonitis in adult cattle. So TRP को हार्डवेयर डिजीज भी कहते हैं. ये मोस्ट कॉमन डिजीज है एडल्ट कैटल एंड बफेलो की, caused by ingestion of foreign bodies that perforate their foregut. We are also discuss in this paper what are the foreign bodies, potential and non-potential. So cattle buffalo have unique mouth anatomy, and due to their long prehensile tongue, they graze feed without any selection of feed items. Due to their unselective feeding habit, foreign bodies, metallic and non-metallic, mixed with feed, often make entry into their stomach. So what is definition of TRP? Perforation of wall of reticulum by sharp foreign body produce acute local peritonitis. Etiology: accidental ingestion of foreign body through feed or while grazing in the pasture, lack of oral discrimination in animal, tendency to lick metallic object, greedy feeding. Pathogenesis simple: foreign body after ingestion pass to reticulum and may entrapped there due to honeycomb appearance of reticulum. Foreign body may pass toward thoracic cavity causing damage to lungs and heart. It also take different course causing damage to liver and spleen in abdominal cavity. Clinical sign commence after 24 hours of penetration. So clinical finding, you will find high rise in temperature, sudden anorexia, ruminal status means constipation, local pain in abdomen, pain on movement. Recovery may be occurred if treated. It may lead to chronic form resulting to acute diffuse peritonitis. Now how you diagnose it? So done by taking history, clinical finding, paracentesis, reticular radiography, ultrasound, use of metal detector, and the tests have been recommended to include reticular current test, Scoos test, pole test, slope test. Line of treatment: conservative treatment include immobilization of animal, front feet elevation, reduction of roughage feet, administration of antibiotic, surgical treatment, ruminectomy, and repair and post surgical measure. So you can see in photo also. Now second question is describe various stages of fracture healing. So we fastly discuss key points of fracture healing or bone. It's also called bone union process. So it's two type mainly: direct healing and indirect healing. Direct healing is also called osteonal reconstruction, and indirect healing is called intermediate callus formation. So direct healing again two type: primary osteonal reconstruction and secondary osteonal reconstruction. And primary osteonal reconstruction again two type: contact healing or gap healing. Contact healing occurs in zone of cortical bone contact, and gap healing occur in small fragment gaps between contact zones. Now secondary osteonal reconstruction, its osteonal remodeling occur with callus. Now discuss indirect bone healing. The osseous tissue formed through transformation of fibrous tissue or cartilage. This occurs when there is more inflammatory deformation, impairment of blood supply, more width of fracture gap, all this. And stages of indirect fracture healing: inflammation, soft callus, hard callus, remodeling. These notes, these PPT made by our Dr. Anil Kumar sir. So you also refer this PDF. So inflammation begin immediately after fracture and remain until fibrous tissue or cartilage formation. Hematoma form from ruptured blood vessel. Soft callus begin with appearance of granulation tissue. Granular tissue mature into fibrous tissue and or fibrocartilage. Hard callus include mineralization, endochondral ossification, cancellous bone, and last step bone remodeling. This process is carried out by balance of hard callus resorption of by osteoclast and lamellar bone deposition by osteoblast. Remodeling process initiated 3 to 4 weeks time, but it may take years to complete it to achieve a fully regenerated bone structure. ये मतलब 1 महीने बाद शुरू होती है और सालों तक चलती है पूरा रीजनरेट करने बोन को. So let's discuss last major question of this paper. Discuss the principle of physiotherapy, its scope and limitation in veterinary field. So what's the veterinary physiotherapy include assessment and treatment of musculoskeletal system and neurological condition. It incorporates the analysis of neuromuscular system anatomy to find accurate problem. Physiotherapy has long been used in human medicine with vast amount of research published as to its benefit. However, the use of physiotherapy in veterinary practice is a relatively new concept, and evidence-based research treatment is its infancy. So its scope is very high क्योंकि ये नया नया कॉन्सेप्ट आया है, तभी इसका स्कोप बढ़ेगा और इस पर और ज़्यादा रिसर्च होगी. So let's discuss its principle. It to decrease pain and facilitate healing of inflamed and injured neurological and musculoskeletal tissue, maintain normal range of motion in affected joints, hand limb, forelimb, prevent soft tissue contracture and fibrosis in weak or paralyzed limb, improve strength and function of weak and paralyzed limb, maximize post-surgical recovery and function of the patient, provide positive psychological effect for the patient and owner. And limitation: there are multiple problem in institution of physiotherapy in veterinary practice. Veterinarians are faced with the management of animals of all sorts, small to large, light to heavy, docile to vicious, various species, breeds, and heavy body weight, prostration, pressure sore, pre and post operative recumbency, muscular atrophy, inability to get up are some common problems, especially in large animals. So this is very serious issue faced by physiotherapy. So these are main limitations. So thank you very much, and especially thanks to uh, the notes provided by our sir, and uh, book related to surgery like Fossum, Nandi sir, and RPS Tyagi sir, and tanuvas notes, Kerala notes. All these notes are helpful to making these PPT, and also the quizpedia notes, which are also helpful in this making video. So thank you very much. Like, share, subscribe जरूर करें. Thank you once again.